mynews.studio.
A drop of blood might soon tell us if someone is at risk for dementia, years before any symptoms appear. Could a simple blood test really change the outlook for brain health?
Today is August 8th, 2025. Let's break down the basics first. Dementia, especially Alzheimer's, is often diagnosed too late for treatments to have their best effect. The main problem? The standard tests, things like PET scans or spinal taps, are costly, invasive, and hard to get. So many people go undiagnosed until their symptoms are already severe.
Exactly, and that's a huge challenge because catching dementia early opens up more possibilities for care. Now, we're seeing large-scale trials for blood tests that could really make a difference. These aren't just small studies. They're happening worldwide, aiming to bring these tests into everyday clinics.
Let's dig into the details. What do these blood tests actually measure? There are a couple of proteins, biomarkers, like MTBR tau 243 and p-tau 217. Recent research suggests these can indicate Alzheimer's in the brain with over 91% accuracy. That's almost as good as PET scans, isn't it?
That's right. For instance, Roche's Alexis p-tau 217 test shows PET scan level accuracy, but it can be run in a typical clinical lab. So in theory, you could be screened for early Alzheimer's by your local doctor instead of needing to travel to a specialized center. And in the US, the FDA has already cleared the first blood test for Alzheimer's.
Does that mean these tests are ready for widespread use, or are there some caveats?
That's a fair point. Not all blood tests are equally reliable. Some meet high accuracy standards, but others don't. And most of the research so far has focused on higher income countries, often with less diverse groups of participants. That means the results might not apply to everyone. For example, people from different backgrounds, or those with types of dementia other than Alzheimer's.
That's important. Most of these blood tests are built to spot Alzheimer's-specific changes, but conditions like vascular dementia or Lewy body dementia might not show up. So, while this is a major step forward, it doesn't cover every type of dementia.
Exactly, and that leads to another challenge: how health systems decide to use these tests. The Alzheimer's Association has put out some guidelines, but rollout will probably start in places like the UK's NHS, aiming for 2029. Still, in areas with fewer resources, just having access to a blood test is a big leap compared to no testing at all.
So what will this mean for patients and families? Early detection lets people plan ahead, try treatment sooner, and can ease pressure on caregivers. But health systems will also need to offer more support and counseling. Are we prepared for that kind of change?
That's hard to predict. Early diagnosis can definitely improve quality of life and give people more choices. But it also means investing in more follow-up care and long-term management. Policymakers are starting to plan, but with dementia cases expected to triple by 2050. Over 150 million people. The pressure will only grow.
So, in summary, blood tests for dementia are moving from research labs into regular clinics. They're quicker, less invasive, and nearly as accurate as traditional scans for Alzheimer's. But there are still hurdles, especially for other forms of dementia and diverse populations. Health systems will need to adapt, and the broader impact on society could be significant.
Yes, and if these trials prove successful, we could be looking at a future where early and accessible detection is the norm. That could mean better treatment options and a real opportunity to slow down the dementia epidemic.
That's where we are. Science is changing how we understand and tackle dementia. Thanks for joining us. This episode was brought to you by mynews.studio. Try it now for free.